So you've passed your due date and now the big question is hanging in the air. Should you consider an induction or is it better to wait? If you're feeling overwhelmed by all the information out there, you're definitely not alone. In today's video, we're diving deep into this topic, unpacking what the latest research really says about induction when you're overdue. I'll be sharing some surprising findings from a major study conducted in Norway that looked at over 1 million births. We'll talk about what they discovered, why the rising rates of induction are causing concern, and, most importantly, how can you make the best decision for you and your baby? This video isn't just about numbers and data. It's about giving you the information you need to feel confident and empowered in making a decision that aligns with your instincts and values. So if you're unsure about whether to go for an induction or to wait it out a little bit, this video will give you the clarity you need to navigate this choice. Let me start by saying that it's completely natural to feel a bit anxious as you approach or even pass your due date. So if you're overdue, you're not alone, and I'm here to share some insights that will hopefully put your mind at ease and help you make the decision if an induction is right for you. Let's look at the big picture first. Many countries have seen a rise in labour inductions over recent years, and there's often a push to induce labour as soon as a baby is even a little bit overdue. But interestingly, studies have shown that this routine induction trend may not actually lead to significant positive outcomes. In fact, the benefits we see from it, such as a slight reduction in stillbirth rates, are often very small. One recent study from Norway looked at over 1 million births. The researchers found that between 1999 and 2019, induction rates went up from just under 10% to almost 26%, especially for babies at 41 weeks. So why is this happening if the benefits are so modest? Well, the main reason is a slight decline in fetal death rates, but we're talking about a change from 0.18% down to 0.13%. While every baby's life is absolutely precious, it's important to remember that hundreds of inductions would need to be done to prevent just one stillbirth. This raises the question, does it make sense to put so many women through this process for such a small improvement in outcomes? And remember, stillbirth rates only tell part of the story. When we look only at short-term outcomes, we might miss the medium and long-term effects of induction on both mothers and babies. Studies show that women who have inductions often experience more medical interventions later, like a caesarean section or assisted deliveries, which can lead to higher risks of implications. In fact, the rate of postpartum hemorrhage in Norway increased from around 11% to over 30% as induction rates rose. So while induction does lower the chance of certain outcomes like a stillbirth, it also brings an increase in other risks. It's completely normal to worry about these things, but remember, you're allowed to ask questions and explore options. Many women who've gone through inductions have shared their experiences, and it's not always easy. Some report feeling a lack of privacy or comfort, and they often feel like it's a process with a lot of ups and downs. But here's the thing, each person and each pregnancy is unique. And while studies help us to understand general trends, it's okay to talk with your healthcare provider about what feels right for you personally. So what's the takeaway here? Well, if you're overdue, it's not necessarily a cause for alarm. Medical guidelines and studies like the recent one in Norway remind us that being a bit overdue is often just part of a healthy pregnancy. And in most cases, it's perfectly safe to wait a little longer if both mum and baby are doing well. Ultimately, the choice of whether to induce or wait is yours to make. Don't hesitate to ask your healthcare team for all the facts and to help you weigh the benefits and the risks. Your comfort, safety, and peace of mind are all so important. Here's a simple way to make an informed decision by using the BRAIN acronym. So think of BRAIN. B for benefits. What are the good things that could come from this choice? R for risks. What are the possible downsides? A for alternatives. Are there other options I could consider? I for intuition. How do I feel about this? What does my gut tell me? N for nothing. What happens if I decide to do nothing right now? Let's take a look at one of my clients who used this framework to decide whether or not she should be induced. So here's a scenario. Sarah is 41 weeks pregnant and is feeling a bit uncomfortable as she approaches the end of her pregnancy. During her recent prenatal appointment, her doctor mentions that because she's past her due date, induction is an option. Sarah takes a moment to think through her decision using the brain framework to weigh up her options. So B for benefit. Sarah considers the potential benefits of induction. She knows that inducing labour might help her avoid any risks that can come with going too far past her due date, like small increased risk of stillbirth. Induction could also mean that she gets to meet her baby sooner, which feels exciting after weeks of anticipation. R for risk. Next, Sarah thinks about the risks. She remembers reading that induced labour sometimes leads to more interventions, like a higher chance of a caesarean section or needing assisted delivery with forceps. There's also a risk of stronger, more intense contractions, which might make labour more uncomfortable or require more pain management. A for alternatives. Sarah wonders if there are alternatives to being induced right away. She asks her doctor if she could wait a few more days, allowing her body the chance to go into labour naturally, as long as there are no signs of complications. Her doctor suggests monitoring the baby's well-being closely with regular checkups and offers the option of a membrane sweep, which is less invasive than a full induction and could help get things moving naturally. I for intuition. So Sarah checks in with her own feelings. Her intuition tells her that her body and baby might just need a little more time to get ready. She feels like her body has been doing a great job so far and trusts that it might start labour on its own if given a few more days. N for nothing. Then she thinks, what if I do nothing right now? She realises waiting a bit longer may not have a negative effect, and as long as she and her baby are being monitored, she's quite happy to wait. So taking this option allows her body the chance to initiate labour naturally, which feels like the gentler route. Sarah decided to wait a few more days while also being monitored closely. She felt empowered knowing she was making an informed choice that aligns with her body's natural timing and her comfort level. Using the brain method allowed Sarah to weigh her options carefully, consider her intuition, and make a decision with confidence and peace of mind. Thanks so much for watching. If you found this video helpful, please give it a thumbs up and subscribe for more pregnancy and parenting updates. Remember, trust your instincts. Ask lots of questions and know that you're doing an amazing job. Take care, and I'll see you in the next video.